Hi, this is Jessica DeMassa, and I'm at the HISA Studio here at HIC 2017. I'm with Andrew. Andrew, please introduce yourself for everybody watching.
Yeah, hi, Andrew Williams. I work for Intel as the Health Industry Manager for ANZ.
So tell me what you're working on right now for Intel. Tell me what's going on.
Yeah, it's really exciting. I've been there now 8 weeks, so exploring the opportunities in terms of what Intel can do in terms of our partner ecosystem and really what our key customers in the region are doing.
What are some of the priorities for Intel as far as technology is concerned and kind of helping move forward this digital transformation of healthcare in Australia? What are your priorities?
Yeah, when we look at the things we've invested in globally, and Intel's obviously a large organisation, invests lots and lots around the future of healthcare as one of those key industry verticals, around AI, and people talk about that a lot, but there are some key investments we've made and things that we'll work with our partners in the ecosystem for New South Wales and hopefully with some of our customers that are here at HISA to implement. IoT talks about the same thing, and how does that impact edge computing, which is obviously clear for Intel. So they're probably two big areas that I think are relevant to healthcare.
Okay, so let's talk about AI for a second real quick. And so what kind of uptake are you seeing? Are organizations here ready for this, or where are we at?
Yeah, I think for those who saw Malcolm from Alcidion's talk this morning, I think that was really interesting of showing it is here now. There's organisations like that who've been investing in that over a period of time.
Okay, I'm going to stop you there because not everybody has seen the talk. So can you tell us a little bit about what he said?
Yeah, so they showed a model around how do they better predict patients in ED, and it was using fairly simple machine learning techniques to support that and visualise that for people to make decisions within the ED. Where I think we'll see that move to is the opportunities to pull different data sets at different points. So you'll actually be running these algorithms consistently, whereas most of the machine learning work at the moment is for a period of time. We run it once a day, we run it 5 times a day, and therefore it'll update the model and present that information. What we'll see move forward, I think, is going to be interesting as these start becoming run continuously, feeding very continuous results.
So it'll be real time, and the data will just continue to accumulate, and we'll continue to get insight from it.
Yeah, and we're talking about data that isn't predictable, and I think that's what's going to change. So that'll be really interesting in health.
Yeah, that will definitely be interesting. And then talk to me a little bit about, you had mentioned Internet of Things. So tell me a little bit about what you're seeing there. Are there any big trends? What's everybody looking at right now? What's hot?
What we're talking to customers about and we're seeing is the question of fog computing. So it's the smart device at the edge. The challenge is going to be, as we're collecting more and more data, how much of that data has to be pulled back to the data center across the network, and that'll be a limiting factor. So the concept is around fog computing, and how does that start to change the devices that need to be at the edge, the architecture to support those, what data is held at the edge, how are they secured.
So what can we expect then for those devices that are at the edge?
I think it's evolving now. I mean, there's lots of organisations defining how they want to position in that space, because everybody was wanting to pull stuff and pull big data, and I think we've seen a leap past that now that we're starting to go, well, how are we going to start processing that data at the edge? So I don't think there is an answer yet. Intel have perspectives on that around the sort of organisations we're supporting that are obviously Intel inside.
Yeah.
But those others that, it's going to be really interesting just watching that over the next 6 or 8 months.
So in Australia, Intel obviously are a global company, massive, and you're working with health systems all over the world. So in Australia, are there any particular challenges that you're equipping yourself for, that you're facing with the organizations that you're encountering?
I think, being honest, probably a bit too new in the role. So the last six or 7 weeks has been very much exploring. We had the conference in New South Wales last week, which was great. So this opportunity at HISA is great, and with HIC to come and meet a bunch of the core customers, understand what they are facing at the moment, and how do we apply in my new role.
Is there any one question that you keep getting asked over and over again?
No, not specifically. There's just such a plethora of, from an Intel point of view, there's so many things we're investing in. What does that look like, and what does this look like? And so it's been great working through that. And for me, there's usually a lot of homework that comes out of every meeting with every customer.
So what's the biggest opportunity that you see moving forward?
I think it has to be in that data and analytics space now. Call it AI, call it what you want to call it. But ultimately, as we move into cognitive computing and how do all those different models work together for AI, I think it's going to be dramatic over the next 5 years.
Fantastic. Well, we look forward to watching that future unfold. Thank you so much for joining us here at the HISA Studio. I'm Jessica DeMassa at HIC 2017.